Welcome to the Osteopathic Center podcast. I'm Dr. Christopher Goddard, the founder of the Osteopathic Center, and today I'm going to talk about why did I even dream this up? Why did I want this to happen? And how did this office actually come to be? You know, almost all of us in regenerative medicine or integrative medicine, we almost all have a story to tell. We had something that caused us to make us think about what would make us and make us have a desire to be in this field. So mine came right before medical school, and it was 1 month, and this was in 2003, and I got injured. I was playing softball, and I had a ball hit me right in the mouth, knocked my teeth backwards, and went straight to the ER. Luckily, I didn't lose my teeth, but broke a couple. Had to get my teeth wired together. Started having pain every day. Started having massive headaches, and obviously pain at the teeth level, sensitivity, and it caused a pretty significant deal to my quality of life. And because of that, I obviously was seeing a maxillofacial surgeon, was going to therapy all the time. These things were temporary, relief at the best. I was popping Motrin a day. And let's fast forward a little bit, because after a month, I was still taking 10 to 15 Motrin a day, and I'm starting medical school. And this caused me a lot of sleepless nights, because I was started to get ulcers, started having a lot of extra pain problems, kept seeing more and more different therapists, different surgeons. At the end of the day, nobody had an answer. Even me going to an osteopathic school, I wasn't completely aware of everything that osteopaths had trained in. And after a few months of taking some classes and courses and hearing about the craniosacral therapy, I thought this would be a perfect chance for me to try it. And that's what I did. I started going. And it took me 3 months into medical school. So at this point, 4 months into my injury, it took me before I decided to do something that was different than mainstream medicine. And I went, and for the first time in 4 months, my pain was gone for 24 hours without taking a pill. And I was like, wow, that's pretty good. But it came back the next day. So I went back a week later, and I saw the doctor, and I said, well, okay, it was gone for 24 hours. He's like, okay, that's a good start. Okay, so let's do it again. So we did it again. This time it was gone for 2 days. And after that, as you can kind of get the pattern, I went week to week, and the pain kept getting and staying away for longer periods of time, the more I went. Now, over time, though, we would get to a point where I would get treated maybe once a month. It would be gone for 2 to 3 weeks, and the pain started to creep back in. And we decided we needed to do some extra things. And these were, one, regenerative injections into my jaw. The theory was that when the ball hit, it created severe instability in my TMJ joint. And because of that, even though we would fix things, the looseness would still allow it to go back out. So I had injections in the ligaments and the muscle surrounding this area. And that helped significantly. And the other was adding acupuncture. I had both pain management acupuncture as well as more of a holistic acupuncture, even a Japanese scalp acupuncture that went down my scalp. And so I had all that done around here as well. And between all three of those, it managed to get my pain away. And that's when I first started to understand and have a strong belief that this is a field that I could get into. Now, I definitely, like I kind of alluded to, I definitely did not choose this immediately. I went the traditional path. My original degree in undergraduate at the University of Tennessee was biochemistry, and I also got a minor in mathematics and a minor in religious studies. I was very heavily to the research end. I did 2 summers over at Oak Ridge National Laboratory doing all lab work. I did work at the University of Tennessee Medical Center doing cell culture, cell work on cancer lines, as well as looking at flow cytometry to analyze the cells. And that I'm heavily into the science world, heavily into the research world. And so for me to veer off, it took a lot. But it came a point in time where, when you realize people are not helping you, and after I saw about 5 different physicians, I saw 4 different therapists, and at some point I had to make a decision to try something different, and I'm glad I did. So that belief though, that underlying belief in the science and knowing what really is true versus not, going back into the scientific theory, it has been a pervasive thought process how I came to build this business, because it took my personal experience and then I had to start exploring. I explored the regenerative injections. I did a fellowship, a pre-doctoral fellowship in medical school for the manipulation, where I was exposed obviously to the manipulation I had, whether it be hard and soft techniques, as well as the regenerative injections. That was prolotherapy, PRP. Stem cell wasn't quite popular when I was going through that part of my training, and then acupuncture, and it spurred me even to get go through an acupuncture school. I went through the UCLA school for acupuncture, and I got my I did all my training for that, got my certification, and I did that for a number of years. And I was I started out doing just manipulation and some prolotherapy and the acupuncture. And then as I went on, I kind of saw how effective it was, but some people didn't get better. And my thought was always, well, why aren't they getting better from these things? And PRP, platelet-rich plasma, was becoming a new thing, so to speak. And I had some difficult to treat patients with prolotherapy, treat them like 10 times and we're getting better. So somebody came in and said, hey, you know what? Why don't you try PRP? I'll give you a few kits to try on people. Try them on your hardest people. I did one treatment on these hard to treat cases. Their pain was gone. And so that got me into PRP. And I started doing that heavily. And so at this time, I also had a hip injury myself. I always thought the injury, the PRP, the Prolo, was going to be beneficial and helpful to people. But I had an injury to my hip, or I thought was my hip, and I couldn't get better. It took me 6 months before I decided to see a doctor. And at that point, of course, we tried cortisone. That didn't help. Went to physical therapy. That didn't help. Did osteopathic manipulation. That didn't help. Even went to a pain management doctor that did a fluoroscopy injection with steroid. That didn't help. And finally, I met a guy at one of my training courses in the regenerative injections, and he does only regenerative injections. And went to follow him at his office, and he goes, "Here, let me feel what's going on." He diagnosed me with a glute tear, a gluteus medius tear in my right hip, and he injected it with a mixture of prolotherapy and PRP, and it was extremely painful, and I couldn't even walk. I could barely walk that night, and even a little better, but I could barely walk the next day either. But it took 6 weeks for this to go away, for the original pain from the injection to go away, and I was 90% better from my original injury, and that's what solidified the deal. Even though I had the initial experience with my jaw and I got better, I still had skepticism. I still couldn't understand how does this work. We need to break down the growth factors, the platelets. We need to break down the chemicals. Now that I'm in stem cells, we need to break down every last growth factor in stem cell and protein and cytokine and bone marrow and adipose and exosomes and amniotic, umbilical. Even though my mind says that, after he was able to fix me, it really made me realize something. The most important thing is your body. Your body, if we give it the right thing, if we point out the right place that it needs to heal, it will do its best to heal that area. Now, do we have different levels of what we can give? Absolutely. But the most important part is putting that needle in the right place. I'd been to many doctors, like I said, therapists, everybody, and until we got that needle in the right place to help regrow that tissue, I was not going to get better. And that injection in my hip was probably 9 years ago. Have not had another problem with that area ever since. It only took one shot. Now, most injuries don't just take one shot. If you come to us early enough, we can get them done like that, but most of them are going to take a few treatments to get you better. But I just wanted to give you my evolution into how and why I wanted to begin this practice. And even though coming from a very extreme scientific background, working at a national lab, working in cell culture at a major hospital, and even with a biochemistry degree, some things we don't always understand. Now, we want to keep doing this research, because if we can ever absolutely define exactly what we're using and what is the best part of the bone marrow, best part of the PRP, best part of the adipose, of the amniotic, umbilical, the exosomes, the prolotherapy, whatever it may be, if we can define that, we are all going to be much better off. And we're going to be able to take this field to places that nobody knows where we could be. And then we can actually share that information across all fields of medicine and with every physician and all fields of therapy, as it relates to pain, as it relates to sports. So I just want to share that with you. Thanks for joining us today.